Hello, I'm Jared Weiss, medical oncologist and vice president of Cancer Grace, and it's my pleasure to be here tonight with Josh Baumel, Dr. Josh Baumel of Hospital of University of Pennsylvania, and Dr. Sid Sheff from the University of North Carolina. We're here tonight to discuss advances in cancer treatment of head and neck cancer from the ASCO 2017 meeting. Welcome, gentlemen.
Thank you very much.
The best way to solve a problem is perhaps to prevent it in the first place. And we had an interesting abstract about HPV vaccination at this year's ASCO.
So this was really exciting because we know that we have vaccines that target human papillomavirus or HPV, but most of that data refers, in terms of the public space, refers to how it can prevent cervical cancers and pre-malignant cervical lesions, so the things that are detected on pap smears. But we don't have any sort of screening for head and neck cancer, and that's one of the reasons why head and neck cancer is, if not now, will be very soon the most common cause of HPV-related cancer in the United States. And that's because screening for cervical cancer has gone up so much. So what we saw today was Dr. Gillison presented data from NHANES. Now, NHANES is a gigantic survey study. It's a huge survey study where, in addition to surveys, they actually have contacted these people and gotten samples. So one of the samples they were able to get was a mouth rinse. And this is something Dr. Gillison does in her lab. It's actually like alcohol-based mouth rinse. I think they usually use scope. And they rinse it in their mouth, they spit it into the cup, and then she is able to detect in her laboratory various forms of human papillomavirus. So the ones that they were looking for in this study were the ones that are present on the most common cervical HPV vaccines.
Also the same ones causing cancer, cervical and head and neck cancer.
Exactly. So 1618, which happened to cause most of the head and neck and cervical cancers, is also 31. These are the ones that are seen. But also HPV-6, which is associated with rarer cancers, is also on there. So they were looking for this. They know that this exists. So then they looked at all of the patients in the survey, and they found out how many of them had had a single vaccination with this HPV vaccine. And what they found was that the incidence of HPV infection in those patients went down markedly. In fact, amongst men, and as we said, this mostly affects men in head and neck cancer, it decreased it by 100%.
100%.
100%. And then there were really exciting graphs which they were able to show. They say, okay, well, here's how many HPV infections there are. And it turns out the answer is a lot. HPV is essentially ubiquitous. It's always present. Here's how many HPV infections we could prevent if everyone who was supposed to got vaccinated. And that number was 88% because women had a slightly less protective effect. And then they said, well, here's the vaccination rate now. And that was 17% of what we want it to be.
So most people who are supposed to be vaccinated are not being vaccinated in childhood.
That's right. And I think there are a lot of reasons why that's happening. But I think that one of the reasons is that many people are not vaccinating male children because they think it doesn't really help them and might expose them to some unknown risk. So two things. One, we know that this vaccine is safe, so there isn't unknown risk. And second of all, we're seeing this is a cancer that is primarily in men. So these people are doing a disservice to their male children when they grow up. If we could prevent these HPV infections, the theory is we could prevent HPV-related cancers as well.
So we haven't proven that this will prevent head and neck cancer. It just makes extraordinary common sense.
That's exactly right.
A very compelling story that will have to wait years for proof. But let me ask you this. You have boys.
I do.
Will they be vaccinated?
Early and often.
Are you afraid that the vaccine might hurt them?
No.
Why not?
Because we have significant data of the safety of this and other vaccinations, and we know that this vaccine can prevent this infection, which we know causes cancer. And it doesn't just cause head and neck cancer. There are multiple other cancers that are associated with HPV. And if I can decrease the risk of cancer in my children's lifetime, that is something I want to do.